All right. Good morning, everyone, and thank you for joining us for what I hope will be a very informative and um, inviting webinar discussion around our topic of today, which is focused on violence intervention programs and violence reduction. So this is a webinar that will give you some additional insight into a new master's degree that we have here at University of Maryland, Baltimore, in partnership with Coventry University and their Center for Peace, Trust, and Social Relations. And the master's degree is on vulnerability and violence reduction in communities. And so I'm looking forward to hearing our panelists today and how this will unfold as we're all going to provide for you some perspectives from where we've come from and what our current work may be. So I will begin speaking to you a bit about that, and then we'll have Erin Walton speaking, as she is a program manager for the Violence Prevention Program at the R. Adams Cowley Shock Trauma Center, Center for Injury Prevention and Policy at University of Maryland, Baltimore. Then Bill Joyner will be speaking, and Bill is the Equity Officer with Baltimore City Police Department. And then we'll have DeCarlo Cornish speaking. And DeCarlo is the author of a new book called What Could Have Ended My Life, Changed My Life, the autobiography of DeCarlo Cornish. He is also the CEO of Amir Arman, a clothing brand dedicated to quality style and innovative design. And he really hopes to show the way out of those way out for those who experience hardship and help others end their pain as well as suffering that many are enduring. He also is a youth advocate at a youth facility. So, and then we will open this up to questions. And so I'm going to begin briefly saying that I come at this work from a variety of perspectives, but I can't help but think back on my initial work as a visiting nurse and a home care nurse, working with many people and individuals who had experienced violence. And I reflect back on Joe, was a patient of mine, and he was a victim of gunshot wound in 1987, I believe, way back when. And I used to visit him every evening around 6 p.m. to do wound care, and his more than half of his buttocks was excoriated from being bedridden as a paraplegic from a gunshot wound. And I ultimately had this really meaningful relationship with him, and I often would see him on the streets of Baltimore as I would be going to visit his house. And some days he would say, "Oh, not today, I don't want to do it today," and he'd be willing in his wheelchair up Ashland Avenue in East Baltimore. And I learned a lot from him, and he taught me a lot about what it meant to continue to be a victim of this. And he ultimately died of an overdose, and that really was a sad day for me because I really cared a lot about him. But I also think about his family and the many families of people who are victimized by violence. And in my experience as both a nurse and as well as a public health researcher, I feel like compelled to say that it's continues to be what I would say is a significant epidemic, even in our own Baltimore City. And today alone, we are at the number of 96 homicides for the year of 2021. But it's not the number to me, it's still the names of those individuals. And in the last 3 days, we have Quentin Bryce, David Mason, and Demetrius Henry, who all are either 36, 32, or 24-year-old victims of violence. And it's not just those as individuals, but it's their families, it's their friends. It's the lives of the people in the communities where they've come from. And it's really the city of Baltimore that continues to feel the effects of this. In my other experiences, I've worked in other countries where violence is a major issue, and I've been a part of, on the macro level, facilitating health systems strengthening in countries post-violence. Some of my most recent work was in the country of Libya post the Arab Spring and the violence that happened there. And I was there when the president was kidnapped, for example, and I saw bombed out buildings, and I worked with directors and ministries of health who were continuing to support their countries in spite of the war-tornness of it. And subsequently, we were no longer able to work in that country because the violence just continues to overrun that country. And I've worked in other countries that were significantly post-war torn. And it's an issue, it's a prominent factor. And then back to Baltimore City, I mean, I work as a health professional, but I also am a citizen of the city, a longstanding lifetime resident of Baltimore. And I worked with the Baltimore City Police Department doing things like volunteering and citizens on patrol. And so the last quote I will say is one of the things that I've been compelled by is a recent book I'm reading by Paul Farmer from Partners in Health about fevers, feuds, and diamonds, and that to really understand and experience and know the depths of how violence affects our communities and the vulnerabilities that are at present in our communities is to live in proximity of this. And that's his quote. And also, I feel like that's the truth of some of my experience, is that it's really about being present to those individuals who have been a part of that, my own experience in being and witnessing violence. And then finally, years ago, I worked with grandmothers who were raising their grandchildren, a program that I ran in collaboration with the school and a church in East Baltimore. And those grandmothers, their children were either in jail or were had experienced the loss of their own children because of violence in a variety of ways and paths. And then they were now committed to raising their grandchildren. And our program was really in support of them and trying to facilitate the children themselves and also the grandmothers in that support process. But I'll just never forget the stories that, for example, this one woman told me, Miss Betty, and how she recognized her own mistakes, but was just passionate about what to do about changing the dynamics of her own family as well as the community, and would be on the street corners and just trying to mentor the young kids in that neighborhood, trying to facilitate and change that path. So there's a variety of ways we can think about prevention and intervention. And on a primary level, we can look at it from that perspective, secondary and tertiary. And we're going to hear from everybody to what level of prevention can occur around trying to facilitate violence and really mitigate the process or mitigate the after effects. So without further ado, I'm so excited to hear from our panelists today and really welcome your questions as we move forward. But I'm going to now ask Erin to comment on her experience and her work, and we'll go from here. Thank you.
Yeah, thanks, Lori. Well, I wasn't really looking forward to following you, but now I just want to sort of be like, pass on to the next now. What a storied career, and probably one of the reasons that I met you early on in my time at Maryland, and we've continued to find ways to collaborate since I started here in 2015, coming here from different areas of clinical and medical social work, where I really honed my skills of explaining to people what limited resources existed and why they wouldn't be able to access them, and finding myself increasingly frustrated with the systems and institutions that denied people access to services and help, and me not feeling so much like a gatekeeper as just harbinger of bad news whenever I encountered somebody who was really suffering. And so after the uprising of 2015, I made a concerted career choice to find a program where I could do a lot of macro work, having had a lot of rewarding experiences working on policy in the legislature and on committees in the city, things like changing the way that mandated reporting is handled by social workers with regards to substance exposed newborns, domestic violence, and things like that. But coming to the violence prevention program at R. Adams Cali at University of Maryland really gave me a chance to explore all aspects of the campus and the approaches being taken from not just a medical approach to violence, but public health, the integrated nursing, social work. Even we've worked with School of Law, School of Pharmacy on different projects, because violence is really at the intersection of so much of the healthcare work that's being done on this campus. And I have found that I've landed in such a supportive area, such a supportive place to address violence as a healthcare issue, as a public health issue. And so here at the Violence Prevention Program, we have primary, secondary, and tertiary responses to violence. We have prevention programs for youth, that have not been exposed to violence. We have prevention programs for youth that are either have been exposed or likely to be exposed to violence. And then we have our intervention program, which is how we introduce services, case management services to patients in the hospital. So the violence is the third leading cause of admission to shock trauma. That's about 1,100 patients a year that are admitted to shock trauma with a violent injury. And our program is here to meet those individuals while they're in the hospital, provide them support while they're there, and act as a liaison advocate to help them begin to navigate their healing process and their journey that they'll embark upon once they are discharged. A lot of times this means helping them with issues of criminal justice that come into play after a violent injury, material resources, psychological healing. And we continue to work with any willing participant. Our program is totally voluntary, and people can access their case manager, the resources of our program for as long as they want following a violent injury. We take referrals from the community as well. A lot of times what we find is that somebody that we meet in the hospital who has a positive experience with our program will tell us that they know many other people in the same situation as them and ask if they can come to our peer support group or if they can speak to a case manager or therapist. And we are really, really lucky that we've always had the capacity to be able to say yes in those circumstances. So I think similar to what Lori was saying, we take a micro and a macro approach. We do really intense individual work with people who are confronting the effects of their trauma and the results of living in communities that have been ravaged by overexposure to trauma and violence. And then at the macro level, we do a lot of awareness raising and advocating to put things, structures, policies, and programs and resources into place now that are going to help generations yet to be born be protected from what we've witnessed our current clients having gone through, or like when you hear from DiCarlo, who wrote a book about his life experience, how the exposure to these risk factors begins at such an early age that it's normalized within the environment or present in the environment before the child really has any sort of choice. And I hope DiCarlo talks about what he was talking about right before we started this webinar. It was so compelling. And so I guess before I pass it to Bill, I'll just say that one of the things that has continued um, to facilitate the success of this program is the collaborative partnerships in research, policy, and practice that we have with the other people that you see up here and in the other webinars from the faculty of this program. And so I think that pulling these people together in this format to deliver this degree, even I'm looking at the participant list and like, hi, all my friends, it's great to see all the players at the table. And so this will really forward the field. It's a really progressive approach to integrating all of our different prevention and intervention strategies that we've been honing over the years. So I'm glad to be here.
Thanks, Erin. And we're going to next hear from Bill. Thank you.
Thank you very much for having me. And so the police, so we're working on a lot of new approaches and changes to our approach in addressing violence. So one that people may be familiar with is the group violence reduction strategy, which really focuses on BP doing our work addressing violence more effectively and strategically. And so it is focusing on delivering, so focusing our efforts on the very small portion of the population that are the most prone to violence, and sort of committing to have swift and swift consequences for violence, but at the same time offering resources to help people avoid the need to engage in violence, because it's usually not a desire to engage in violent behavior. It's a myriad of circumstances that lead people to engaging in that type of work. And so it's forming partnerships with other agencies in the city, and other sort of support providers that can provide people with what they need to get out of or to avoid engaging in violent behavior. And if they do not follow through, providing consequences for not meeting that new direction. But the bigger work, and what we view as the more important work, is really one, addressing the BPD's pattern and practice of creating victims ourselves, of violating the civil rights of certain members of the population of Baltimore, some of whom we violated their rights more frequently and more deeply than others, in ways that really reinforce violence. Systemic, like we were an institution that, our history is that of sort of creating conditions and reinforcing conditions that promote violence. And often we're an agency that uses violence to address violence, which is also not the most effective in all situations. And so a part of that work is sort of looking holistically. We're a part of this citywide coalition led by actually the city health department to use a public health approach to crime and violence in Baltimore, and to focus our efforts on how to most effectively play a role that is more narrowly tailored to one appropriate for law enforcement. So not going to every call, not having armed police officers at every interaction with the public, and having stricter, stronger policies for the way that a police officer will engage with members of the public and investigate certain types of violence and interactions. Another major sort of bucket of our work relating to this topic is changing the role that victims play in sort of the environment of public safety and violence in their own communities. Traditionally, law enforcement agencies, including the BPD, have been at the center of the table or the exclusive members of the table with political leaders about determining public safety priorities and strategies to address crime and violence. And members of the community, victims of violence, they were really consumers of public safety as a service, with the BPD being the producer that was not accountable to the consumers. And so this new shift, what we're trying to do with a more equitable approach to policing and public safety, is that those who are most impacted by violence and crime and disorder are also the most involved in setting the priorities, determining the conditions of public safety in their communities. And so what that looks like is, so one way is we have the community policing plan, that communities that were marginalized, that were the victims of our pattern and practice of violating civil rights, those communities that were most marginalized have been invited to help write, like co-author, like the learning objectives and the training methodologies, the expectations of police officers in engaging with the community. It's almost a year. It started in May of 2020, and the training will be launched May 3rd of this year. And so having so that it's not the DAD model, or like decide, announce, defend, where the BPD says, here's what public safety will look like and feel like, but saying like, what do you think, what does public safety feel like? How should we be interacting as an entire organization? So every police officer will undergo this training co-authored by community members. But at the same time, it's also further down, later this year, we'll also be piloting what's called neighborhood policing plans, where communities, we move the decision-making from City Hall and BPD headquarters about public safety priorities and like intervention strategies for violence, from a one-size-fits-all for the city to each community being able to collaborate with the police and other city agencies to write a plan, to develop a plan for what their public safety priorities are for their specific community, and to develop strategies or interventions, like their preferred approaches to meet those priorities, and methods to hold the police and other agencies accountable for meeting those priorities in the ways that they were expected to. And so it decentralizes public safety planning and accountability so that there's more control and autonomy at the community level. So those most impacted by those crimes or issues of violence in those areas have the most control over what it looks like, the new direction. And so we see this method of centering those most impacted in the process of strategy and accountability as a more equitable and fair way of addressing violence and ideally preventing violence by having more control over the environment by the people who are in that environment. And so I think that was like the fastest way I could try to talk about the new directions we're trying to go as far as the BPD and violence and victimization. Thank you.
Wow, that was a great overview. Thank you, Bill. And we look forward to hearing some questions and more from you. Now I'd like to ask DiCarlo to share with us his perspectives and his work and all of that. So thank you, DiCarlo.
How everybody doing? Um, so my biggest thing, I like everything he was talking about for the community and everything. So my biggest thing I see now, when you have these type of shootings going on or homicides going on, it's always I gotta get back or I can't let it slide. So I figured out a way to show people you can put it behind you, you can put the past behind you, can let it go. And that was my biggest thing to show people everything don't have to be solved with a bullet. So what I did with my situation, I turned it into a positive. And by doing that, I approached the people that set me up and shot me and had me shot. And I talked to them like, listen, we don't have to be friends or none of that, but I feel like you don't have to look over your back. I don't have to look over my back. And I felt like that set the tone for a lot of other people in my community because it was like coming from where I come from, you have to prove yourself or you're gonna worry about what people think. But I did what the community and the streets didn't expect me to do by letting it go and showing that I can be a bigger example and role model in this as far as like the violence. Like you don't have like far as like by me approaching them and not seeking revenge and wanting no revenge, it showed people that there's other ways to go about things. And that's what like I'm not from Baltimore City, but I do see there's a lot going on in Baltimore City, and I feel like I could be a big help far as showing people that you can come together. Hey, let's have a trees. Let's let it go. Whatever happened, happened, and we just move forward from here. And I feel like it need to be more engagement in communities, as far as boys and girls clubs, taking kids to Oriole games, however they can get funded for. And I actually talked to Erin about how one day if I can help her and we can come up with some type of game plan and get funding for the program and with communities and going out and getting these kids out of the community, participate with them, um, just interacting with us because when you're in your community all day, you don't really see nothing else. And that's what I had to learn growing up too. All I knew was my community. But once I started stepping out, because I was in a choice program before, I don't know if you ever heard about that, but they used to take me to homeless drives and we'd feed the homeless. So once you start seeing different things, it's going to give you a different output and outlook on things outside of your neighborhood. But my biggest thing, like I said, everything don't have to be solved with a bullet, and people can change. But a lot of people just don't know they can change because they have the wrong influence on them. And I want to be the person that showed them that you can change. I did come from out of the streets. I did survive getting shot 3 times the first time and got shot 11 times my second time. The second time I really did want to give up. I was just taught, but I knew that God didn't put me in this situation. I feel like I went through this for somebody else, to save somebody else's life, even to save people's lives now that's struggling with depression and mental illness. I went through a dark place as well when I was going through all this because I didn't know why I was going through this. But then, like, the more and more I got closer to faith and interacting with the violence prevention program, earning them, they helped me find myself. Because there been times where I said something to earn like, I had people in my ear saying, "Oh, don't let it go. Don't do this. Don't do that. Or do this and do that." And Aaron had to tell me like I had to take a step back and look at myself. Is it really about not letting it go? Or is it really more so moving forward and showing people that you can let it go so things can change? And it helped. Like I said, I feel like the violence prevention program, it a lot of people need to look more into it because it definitely helped me out.
I'm really inspired by all of your commitments to making things change, whether it be your individual life like you, DeCarlo, or whether it be changing the Baltimore City Police Department like you, Bill, or Aaron, just really working in the health system to, and with individuals like DeCarlo to really help facilitate their changing. And I'm also thinking about just a number of people like all of us together in this are really committed to knowing and believing that violence can be reduced, and that whether it starts, generations down the road, whether it starts immediately at the bedside, whether it starts in the process of the police department. And I'm often thinking about people who say, I'm just giving up. It's not worth it. It's too complicated. It's too hard to make these levels of change. How do we continue to say, no, we can do this because we're in this together? And I feel that with each one of you. And how do we know and believe, and what do we say to say, no, that change is possible, whether it be a culture of change in the organization, the police department, or whatever, whatever level we want to change youth's perspective to say that it's not about getting back at people with a bullet. What do we do? How do we do this? How do we change the cultural mindsets? Who would like to share that perspective? DeCarlo.
I feel like we could change it by, like I say, coming together and they saying that we all interact. It's not just about race, because now the police is kind of like the headline of everything right now. So a lot of people is against the police, but I feel like every police not a bad police officer as well too though. But I feel like a lot of us put ourselves in situations because if you just do as you told and go by what that police is saying at the time, that's all you do. I feel like a lot of us make it hard on ourselves because it's like a lot of people got something to prove. They got their pride in the way and everything. So with that being said, I feel like a lot of us do need to see a therapist. I seen a therapist, nothing was wrong with that. Aaron was one of my therapists, and I feel like some people just they need that positive input on them then that they don't get. Like they they need to be around more positive energy and positive people that's like-minded.
Aaron?
Yeah, I agree with DeCarlo. I mean, DeCarlo, everything that he did took a lot of bravery, but also a lot of hope. And like he said, the second time that he was here as a patient, he was very hopeless, because he felt that the problems that he was facing were overwhelming. And I can relate to feeling that way sometimes in this work and looking at the reality around us. And so, I mean, on a coalition call a couple of weeks ago with the announcement of Joe Biden's, commitment to funding community-based violence prevention, at historic rates, the sort of the thematic feeling coming out of this was like, don't give up hope now, because if we'd given up hope the last time we felt hopeless, we wouldn't be sitting here looking at, $5 billion worth of funding coming out of this administration to support the work that we have been shouting to the rooftops is so necessary. Even if to help one person like DeCarlo overcome a subsequent injury, which could have been fatal. It certainly was more severe. And that is the pattern that we see in the patients that we help, is that the first time that they're injured, we make a connection, we work on some material resources, might achieve some short-term goals or change. But, in DeCarlo's case, the transformative part of his healing journey was the second subsequent injury, taking stock of what he had to lose and what he was able to accomplish the first time without fully committing. He participated in a fair amount of stuff the first time around, and was able to see some positive gains. And then through fully committing, like he said, his mindset, and his purpose and value as a human, and what he can give back to his family and the community, was able to not only achieve all that he's achieved, but set an example for people coming behind him, which is all that we can hope, is that our work has lasting ripple effects, because violence certainly does. And so in order to guard against that through putting protective factors and resilience into the community, we need examples of how hope and change can save a life. So DeCarlo is just backing up what you were saying.
Thanks, Aaron. And DeCarlo, I don't want to minimize something that you said, that you came around the first time, but then the second time having been shot 11 times. I just want to personally acknowledge what an incredible story that is, and incredible you that you are. And you give me hope because you made that commitment. And thanks to Aaron for all of the support that you've offered to DeCarlo along the way. And just don't want to neglect honoring you and saying that to you, DeCarlo, and Aaron, for your support of him. So thank you. And then Bill, other thoughts on your end on how do we change cultural ways of thinking and being?
You know, I think DeCarlo and Aaron were so eloquent about that. This is something that I think about every day, and I'm still really grappling with, because I feel like, you know, how can we change culture and conditions? I mean, a lot of what I think it will take to change like the conditions needed to prevent violence, we know what is necessary, but we lack the willpower as a group, as a culture, as a city, and as institutions to make the commitments needed to materialize those improvements. And that's something I'm still thinking through. How do we do that? It's much, you know, some of the sort of like interventions and like strategies to address the harm, to mitigate the harm, to try to correct the harm. Those things are, you know, lower hanging fruit because they're easier to visualize and the impacts are more concrete and immediate. And I feel like where our culture has gone, as you know, socially and like professionally, you know, we are very focused on short term, like the immediate future, the immediate past. And so one thing I think is, you know, yes, like to prevent violence, you know, how do we prevent people from getting into the conditions that like DeCarlo described about how everything is negative? Like all the choices are hard. There are very few positive avenues that are visible. And those kinds of investments in education and in employment opportunities that are equitable, like to address racism that is rampant in not just the criminal justice system that we, the police, reinforce, but in housing system and the education system and the employment system. And so many of these sort of like other institutions that connect to the system, we fail to invest in what is necessary, what we know to be necessary to prevent those conditions from materializing. And I'm still not sure about what it will really take to make those macro level cultural changes that we know are needed. I think on the institutional level, which I have a little tiny bit more experience in, you know, a part of it is being able to, number one, take collective responsibility to move beyond the, you know, I was not the bad cop that did that unconstitutional arrest or excessive use of force. It's not me, the whole bad apples approach. Because people often forget, you have to remind people that, you know, the second half of that analogy or that metaphor, like a few bad apples, is that a few bad apples spoil the bunch. That if a community member can't trust one or a few police officers to provide justice, then it's hard for them to trust any of us. And so we have to take collective responsibility for the acts of any member of our institution and acknowledge the harm that we have done. And then it comes to all the steps afterward about, you know, not just acknowledging it, but committing to correct it, to making good faith efforts to honor that commitment, doing it transparently, et cetera. And so those types of things are easier to move through the process, sort of like the after violence sort of work. I'm still struggling with how we effectively and sustainably address the preventative needs at a cultural level.
Thank you, Bill. DeCarlo, please.
So I want to get into what Bill was saying. Like he said, we all have to come together as a group, but also what I see I think can work as well is when you got these shootings and violence and stuff going on, I feel like it also should be like somehow they have a center that they can come together and show proof that, all right, well, this side and this side, they got it together. They talked about it and they let it go. What I see when people can see that people letting that violence go, like that beef against each other go, then I feel like that'll open up more doors and lower the crime rate as well. Because like I say, people always worry about the get back. They're not worrying, but I got kids. What could I do to help push my community forward as a leader as well? So if they see that if you just top person in your community and everybody look up to you, you're going to set the tone for that community by letting things go and showing them that enough is enough. We don't have to keep killing each other. We don't have to keep shooting each other. Like, it just take a lot. It just take a lot for, like he said, all of us willing to come together. Also, I think police need to start being more active in the community. Nothing wrong with picking up the trash. Like, I don't mind, even if they're like, hey, one day if you want to come up Baltimore, let's go in the community, pick up trash. Showing that they actually getting people that's off the street picking up trash. Now you're taking the killer off the street, you're taking the drug dealer off the street. No matter if it's for an hour or 30 minutes, you're taking them off the street, and that's one less person that have to be harmed. Be more active in the community. They don't just have to be, oh, when police come around, it's like, oh, we hate the police. No, like he said, you should be able to feel protected when the police come around. Police need to be more active in the community with these kids and with these teenagers and adults as well. Like, nothing wrong with picking up trash or going to the basketball court, having a police officer game versus the people in the community game. So I just think, like he said, it need to be a group effort. And also, with far as getting locked up, the cameras being out and everything, people like I had put in my book, when getting locked up, you're not knowing anybody, you think it was cool, you think it was something that, like, everybody always be like, oh, free my person or free this person or free that. It was like a thrill. And I feel like people need to get out of that thrill, because it was a thrill for me. Being locked up and getting in handcuffs was a cool thing, but it's not, because you don't know nobody. You don't really know who you really are until you kind of, like, you got to discover with other people to find out who you really are. Like, I didn't really know who I was until I went through the violence prevention program, until I got shot and was on my deathbed. So I just wanted to speak on what Bill was saying. I feel like a lot of police officers can also do better and get involved with these communities, as in, like they used to do. When I was a kid, they used to come out, have water fights with us. They interacting, throwing a football around, basketball games with each other. And that's what I try to do with my community. I always try to, like, I'm planning a fun day for the kids. I'm gonna go have a moon bounce, pass out hygiene kits, food, and also have a talk with them as well, and give out some of my books and shirts and stuff, like showing them that I come from the same thing y'all came from, and I changed, so can you. It's not gonna be an easy road. It's the transition is kind of tough, but you gotta be willing to want it. You gotta be willing to want it, and it can happen. Like, I never thought I would be sitting right here in front of you guys and talking to you guys. Like, I never thought that, and it inspired me even more to see that I'm able to talk and network with a program that actually helped me change my life as well. And Bill from Baltimore Police Department, like, I never thought that. So, like I said, I'm willing. Aaron have my information. Y'all have my emails. I'm willing to come out and help y'all. And like I said, I really want people to see that you can let these beefs go. You can stop the beef. Like, you can let the beef go. Don't have to keep on going forward with it. You don't have to keep shooting each other. You don't have to keep harming each other, stabbing each other. Like I tell people, the people that did that to me, they didn't know no better. Because I didn't know no better at once. When I was out there, I didn't know who I was. I didn't know no better. Until you find out who you really are, then you know better. Like, that's why I say I forget on people that did that. And that's the biggest thing I want to teach people. You can forget. If I forgave somebody that tried to take my life, not the first time, the second time, you can do it too. It's bigger than, because I feel like this not about me. This bigger than me. This for Annapolis, where I'm from, Anne Arundel County, and also Baltimore and other cities. Like, it's bigger than me. So I don't even, like, with my books, I get my books out because it's not about the money with me. I really want to help people and show people that you can get out of these streets and change your life. So I don't mean to take up y'all time. I just wanted to get that, talk about that.
Thank you, DeCarlo. It's really a powerful statement in so many ways. I'm really compelled by what you're saying, and also what Bill is saying around the value and the importance of relationships. When we say that all the time, that it really begins with some of the transition, the process, the improvement begins with relationships, but even what you're saying to Carla, it also begins with that relationship with yourself, because it's also knowing yourself that really helps motivate and inspire and keep you on that path. So thank you for that. There's some wonderful comments in the chat for you around, you might want to speak with Damian Cooper from Project Numa, and others are saying keep talking of what to share. What you're sharing is so important. And feel free, all of you participating, to add your questions or comments in the chat. Another question that's come our way is, and I think it's a hot topic, but what do you all think about the whole idea of defunding the police as a movement? And so that question has been raised. Any thoughts around that? DeCarlo.
So all right, so I had to talk with somebody about that, right? Like I tell people, if we were to defund the police, the crime rate will go up even more. That means anybody will be able to harm each other. So a lot of people, and even with guys in the streets, because I had conversations with guys in the streets. If we were to defund the police right now, it would be way more murder rates, way more breaking and entries, way more people getting harmed. Because like at the end of the day, like I said, like Bill said, one bad apple do ruin it for everybody. But that's if that person have that mindset of, all right, well, since that cop was a bad cop, then everybody a bad cop. But you can't have that mindset, because if he did something wrong, I don't think Bill is a bad cop or Bill Potter's a bad cop. That's just something that cop decision that he made that day. And also sometimes just because you're a cop, you don't make the best decisions. And sometimes they don't know themselves. They behind a badge, but sometimes they don't know themselves. So sometimes they have to go through situations like I did to actually find out who they really are. So I don't feel like the fund of police thing is really, I feel like it's not a good idea, because at the end of the day, you do have police out here that do protect and serve, and all police is not bad police officers.
Thank you. That's very insightful. Any Bill or Aaron comments on that question? And Bill, if you want to say no comment, I understand.
I will not avoid the hard questions. So the defund the police movement, I think, has a lot of outcomes in common with a lot of the outcomes in the consent decree. And so the consent decree is the federal court order for the BPD to address the pattern and practice of violating the civil rights of Baltimore residents, again, some more deeply and frequently than others, including Black residents, homeless residents, residents experiencing mental health disabilities or crises, et cetera. A long list of marginalized populations in our pattern and practice here in Baltimore. So that court order has outcomes that I think are shared with defund the police, including a more holistic approach to public safety and crime by the city of Baltimore, including the BPD, not just law enforcement, but public safety service to the community. Another is having the police department formally have a more narrowly tailored and strategic role in public safety efforts. For example, behavioral health. An armed police officer is not always the most appropriate first responder to a mental health crisis, or to something like a nuisance sort of issue. And so identifying ways to more strategically and narrowly limit the role that police officers have in advancing public safety, and expanding the role of other stakeholders like mental health service providers, community-based organizations, et cetera. Also, for things like reduced, ideally to eliminate things like unnecessary and excessive uses of force against the very people the BPD is hired and commissioned to protect. So those kinds of things, I think, were some of the differences. And so there's no agreement, there's no controversy. Where the differences arise in the strategy to get there. Also, I'm not saying that there's 100% alignment, because obviously abolition of the police department, there is no agreement because the consent decree requires that the BPD continue to exist, and that it be actually more resourced than it currently is. But I think that, so the major points there of disagreement are in the strategy of sort of removing the resources from the police department and reallocating them to those other organizations and other services. A big difference is what happens in what order. And it is the position of the police department and of the federal court that a plan for how to better meet these public safety needs be created and sort of resourced. And then as the BPD's role becomes more formally tailored, then its resources can be aligned to match that new role. But until the roles are formally changed, the BPD needs to be resourced at a level that it can meet the service expectations of the community. And many communities, especially communities like mine in West Baltimore, those in East Baltimore, are actually asking for more police service, not less. The thing is, they want less police enforcement that causes harm to them and their neighbors. And we should be able to do that with any level of resources. That expectation should be something that's non-negotiable. And so it's meeting the needs of each community and the level of police service that they wish, and only the level of enforcement that is absolutely required. And so that's really where we are with the defund the police, and sort of like where we stand on what's good or bad, I guess.
Thank you. That was actually very helpful to clarify those really key critical points and the strategies that are important. There's some really wonderful comments in the comments box as well, but I don't see a specific question. Erin, I'm going to shift this a little bit and ask you a question around how do you facilitate, this is a question that's come in, how do you facilitate trust for the individuals that you work with in the violence prevention program? What does it take to really create that level of trust?
Well, I mean, I think it takes, like DeCarlo said, you have to know yourself. What we do is relationship based, and me showing up as my genuine self is how I form relationships. I don't do it differently outside of work than at work. There's a lot of aspects of my social work practice that I learned one thing in school about therapeutic relationships, and I've been re-educated by my clients, thankfully so, over the years about what a therapeutic relationship is to them, because it's defined by them. You know, I am a conduit for healing and for change if that is helpful, useful, and desired by the client. And so, some people come very naturally and easily to the program, and their experience matches their expectations. That's not the case for everybody, and that's perfectly fine and acceptable. And so our approach of never leveraging anything against the client, power, resources, obligations of them, I think creates a space where people can be their genuine selves, and that facilitates the formation of meaningful relationships. And in the context of meaningful, safe, supportive relationships, anybody can accomplish anything that they work on together. And since we don't have time limits or constraints, it's the process, you can leave it, come back to it, take breaks from things that aren't working. And I think that so many people that we work with have been re-victimized through trying to access help, because they are required to fit into the constructs of what society believes a victim is and how they act and look. That trust is built by removing those sort of oppressive barriers for a person and letting them be vulnerable, be honest, and be genuine. That means that if people are engaging in behavior that is on the outside world criminalized, judged, or assigned some sort of label as to what the person's objective is by engaging in that behavior, we remove all of that assumption and bias, and that the person who comes to our program is whoever they are, and they're accepted for that. And if that means that they come and spend time and don't talk and don't use any of the services or anything, that's perfectly acceptable, because our goal is to make the space, to make the person in the space feel like they belong when they arrive, and that in and of itself is therapeutic. And if that is the extent of what they receive while they're here, then we've achieved at least one of our objectives.
Thank you. I can't help but think in what everyone is saying and sharing this morning about the foundational theorist called Paulo Freire, who worked in Brazil to liberate the poor and the oppressed, and his book Pedagogy of the Oppressed always comes to mind. And the one thing in working in some of the community-based organizations I've worked with, there's been a very instrumental visionary Catholic nun who developed a model of service in a community-based organization in Southeast Baltimore called the Julie Community Center, but she worked with Paulo Freire in Brazil, and her name is Sister Bobby. And she always would say and go to the people that she worked with in Southeast Baltimore and the very poor communities in that particular neighborhood before it was gentrified. And she would go, following Paulo Freire's process, go to the people and say, what hurts the most? And if you listen to what people are saying about what hurts the most, they themselves begin to realize their level of oppression, and then they themselves work towards that level of personal empowerment to facilitate and rise up and speak up and advocate against the powers that are causing that level of oppression. And I think to some extent, Bill, that's what you're saying, that the police are intentionally working towards this process of listening and co-producing with communities to reinvent and kind of reconceptualize how community policing is done. And Erin, you're going to the individuals that you're working with out of the shock trauma program and saying, how can we best support? What does a therapeutic relationship mean to you? You're asking that question, what hurts the most from their perspective, not what we come into this thinking that we know. And to Carla, even with you as in your role as a youth advocate, and then going to the people that have, or the person who was the victim, who victimized you, to that extent, you're trying to make amends and saying, this is what was painful in my journey, but how do we change this dynamic? And so we still have a few minutes and some additional questions are coming in, but I would say, like, how do you think the deprivation of this is a different question, but how do you think the deprivation of the pandemic has really led to any additional vulnerabilities in the communities that we're seeing and working with, and how is violence sort of manifesting either more or less as a result of the pandemic, or how has the pandemic affected some of the work that you're doing?
DeCarlo, do you want to answer that first?
Can you repeat that one more time, Phil? I'm sorry.
She was asking how COVID has changed things from your perspective.
I mean, more that is not more things you can't do. You can't do things hands-on right now. So I feel like we didn't expect things to be like this in virtual. So this is kind of new to a lot of people. I feel like it's really coming in between a lot of people as well mentally, because they wasn't prepared for this. It kind of did come in between my work of mentoring and everything, but I still do my part and reach out, and I do visit some people's house, and I just take it a day at a time. I just don't let nothing, because like what I like doing, I don't let anything come in between that, regardless of the pandemic or not. Like, that's what I have a passion of doing, and this helped me get through my therapy. This therapy to me, helping other people get through this pandemic mentally, because this is a big mental thing, this pandemic as well. Like, you gotta be mentally strong for this. And I see that it's breaking a lot of people, and it's also raising the crime rate as well. So kids not being in school every day, and they just got too much time on their hands. So what I do is usually go to the communities take a couple kids, take a walk, go bike riding, and help clean up the community just to get them some time off that mental state, as they like a lot of them don't know what to do right now. A lot of people don't know how to take it.
It's insightful to hear about the significant mental health challenges that are going on, and I applaud you for really just continuing to reach out. Thank you for sharing that. Erin, do you want to offer some thoughts?
Yeah, I think that there are, at the very beginning of sort of like all the initial really strict lockdowns and stuff, a lot of our clients were expressing that the stemming of the flow of resources hadn't yet affected them. A lot of people that we work with often have had to do so much to survive that are outside the formal structures of like getting income and operating, that shutting down all these formal, things didn't impact them quite as quickly as it impacted other people who really rely on formal infrastructure and have always benefited from resource programs and benefit programs, things like that. In addition, it really highlighted the resilience and creativity of a lot of our clients who, like I said, have always been nimble in getting their needs met without a lot of formal assistance. The isolation that DiCarlo described has really sabotaged some people's work, because isolation can amplify so many other negative thoughts that if you don't have the constant counteraction of your peer support group, your mentorship opportunities or your opportunities to be mentored, if you're not comfortable engaging in therapy through virtual formats, a lot of the things that quickly sprang into place to replace what we do when we gather in person are not trusted avenues for good reason. And so now 15 months in, maybe we have established that the people that control these sorts of things can still be trusted. But, we needed to be careful not to assume that because there's this huge new medical pandemic that it's going to help let people unlearn what they learned from living through the epidemic of violence that they have for many, many generations.
Thank you. Bill, did you want to add anything?
Yeah, I think just really quickly, the impact has been really stratified, that some folks are living more comfortably, like they retained their incomes, they're traveling to work less, or they're consuming less, saving more. Others, however, are much more deeply negatively impacted. Housing insecurity and uncertainty about where they're going to live is now greatly increasing, and we have yet to see where we will land with that. And we also have things like, so Erin mentioned isolation and the potential sort of like downstream, like what impacts will there be around like drug overdose and other sort of like downstream impacts related to that isolation, that sense of uncertainty, the disconnection, those types of things. But also so many services and points of connection have gone online in a city where there's a huge digital divide. And so being able to talk about more inclusive stakeholder engagement, like bring people into processes more, and that has become harder to do based on another form of inequity. And so it's gotten more complicated for those at the bottom of the economic hierarchy for sure. And we all know the correlation between the economic hierarchy and the racial hierarchy in Baltimore City. And so the difference has been based on where you fall in those hierarchies.
Well, thank you. And we are about 30 seconds into our time to close. And I just personally wanted to thank you, Bill and Erin and DiCarlo, for really engaging in this conversation and really enlightening us. And I think the best word I would like to remember from this certainly is keep hope alive. We're all hope changers and hope facilitators. And I love that word, DiCarlo, that you brought to our attention today, is really the importance of keeping hope alive. So thank you. And I look forward to working with all of you, certainly in the near future. Thank you very much.
You're welcome.